Missed your periods? Positive pregnancy test? Congratulations, you are pregnant. This sounds magical, doesn't it? It is just the beginning of a beautiful journey. Hello friends, welcome to my channel. I am Dr. Monika Mangla, MD in Obstetrics and Gynecology, and today we will dive through the early pregnancy care. I have seen patients burst into tears of joy or laughter when they hear their baby's heartbeat for the first time. It's an incredible, emotional moment that marks the beginning of a beautiful journey. In this video, I will guide you through what to expect in these early stages, from confirming your pregnancy to taking those initial steps that ensure a healthy pregnancy, healthy mother and a healthy baby. So let's get started on this amazing journey. So first thing first, let's start about confirming your pregnancy. If you have missed your periods and have a positive pregnancy test, then it is essential to schedule your first prenatal appointment as early as possible. In this visit, your doctor will confirm your pregnancy either through a blood test that is known as beta-HCG or through the ultrasound. Through your ultrasound, we may be able to see the pregnancy sac, the fetal node or the fetal heartbeat depending on how many weeks you are. And here we will provide you with the vital information for the coming weeks. In these early stages, taking care of your health is crucial. A balanced diet, proper hydration and safe physical activities can make a big difference. I will share some tips on nutrition and lifestyle changes that you should follow at this time. Which foods to avoid in pregnancy? In pregnancy, we advise that you should avoid smoking. Smoking in any form like vaping, nicotine chewing or shisha is detrimental for the developing fetus. It can cause major pregnancy complications like birth defects in the baby, or there can be a preterm birth or slow growth of the baby. So all these products related to smoking should be a complete no for a pregnant woman. Similarly, alcohol and drugs can cause serious damage to the developing fetus. They should be avoided in all cases. Then we come to caffeine, coffee. That's your coffee. Coffee can be taken in a very moderate amount. The American College recommends 200 mg maximum amount in a day. So you can take it, but in a very small amount. Then we come to raw meat. Raw meat and unpasteurized dairy products, they all come from animals. And if not cooked properly, they carry a risk of transmission of infections from animals to the pregnant woman. They should be avoided by a pregnant woman. Then we see of the seafood. From the seafood, these high mercury fishes should be avoided, like large marine animals, shark and tuna. They contain high level of mercury, which is toxic for the developing fetus. That should be avoided by the pregnant woman. Regarding processed food should also be avoided by a pregnant woman because of the preservatives they contain. And then we discuss the fruits. When we discuss the fruits, we come to papaya. Because papaya, a ripe papaya is good, but a semi-ripe papaya, that is a green papaya and all, they contain latex and papain, which can stimulate uterine contraction and result in miscarriage or preterm births. So these food items should be avoided in pregnancy. What about the other lifestyle changes and the physical activities? From physical activities, hot tub and sauna bath, they are not good for a pregnant woman because hot temperatures are not good for the developing fetus. Then from the pets, if you have cats at home, you should avoid being exposed to the cat litter because it contains the risk of transmitting an infection known as toxoplasmosis. So pregnant women should avoid their exposure to cat litter. And then for general safety, you should avoid wearing high heels as during pregnancy the body balance tend to change, and especially if you are on a wet floor, there is a real risk of fall. That should be avoided in all cases. Then pregnant women should also avoid exposure to wet paints and the fumes and chemical dyes and those things. And regarding your personal medication, if you are taking any kind of supplements before pregnancy, please get them cross-checked with your doctor before consuming them any further. And if any other person medication for any disease, if you are taking anything before pregnancy, get them checked by your gynecologist. The doses may need to be revised or they may be replaced by their substitutes. So don't take any medications on your own without consulting your gynecologist. So now we come on what to eat during pregnancy. Here we will discuss about some superfoods that a pregnant woman should consume. Superfood is a fancy term, but the main purpose behind using this term is related to the extra nutritional value of these food items. So among the most common superfoods that are advised for pregnant women, we have these dry fruits. Dry fruits means almonds are very good. They are a good source of calcium, mineral and proteins, and they have fibers also. So 8 to 10 almonds soaked in water are very good and nutritious. Along with almonds, you can take 5 to 10 raisins, you can take 1 or 2 dates in a day, and these dry fruits are good and they are good source of iron also. So then the milk and dairy products, they are very good, but they should be consumed after pasteurization and proper boiling of these substances. Similarly, boiled eggs are very good source of proteins. As in pregnancy, the demand of all these nutrients is increased, so we need to consume these healthy options. Then we have these chia seeds. They are good source of fiber that helps to reduce constipation by improving the motility of the gut. And avocado is also a very good superfood that provides you with very good nutrients that helps to keep your pregnancy safe. Managing common early pregnancy symptoms like morning sickness and fatigue can be challenging. So we will be discussing them now. I have some true and tried tips to help you navigate through these symptoms also. So to avoid, first of all, what to do to avoid this morning sickness. Morning sickness is triggered by some factors. Some factors means sun exposure, hot weather, direct exposure to flames in the kitchen, or some strong smells of perfume or strong smell of food can trigger your morning sickness. So these things can be avoided as much as possible. Then to alleviate the symptoms of morning sickness, what you can do is you should maintain a good hydration level of your body. By maintaining a good hydration level, we say at least 3 liters of water should be consumed every day. 3 liters of water should be consumed, but that can be replaced by some other liquids like juices, coconut water, milkshakes, smoothies that help to maintain your hydration and give you energy so that you don't feel too much morning sickness and too much tired sensation during your first trimester of pregnancy. So whether you are bursting with joy or feeling a little nervous, don't feel alone. This is a unique journey for every parent to be, and I am there to help you go through it with confidence and joy. So friends, if you find this video helpful, please like, subscribe and hit the bell icon. In my next video, I will be coming up with all the early pregnancy investigations like anti-scan, double marker, NIPT, and clear your doubts on that. So please hit the bell icon. So let's embark on this beautiful journey together.